here with Dr. Rodney.
Hi, we are getting ready for her big day.
All right.
So we're just going through the surgery and the plans. First thing I usually do is the Adam's apple reduction. The anesthesiologist is going to put in a breathing tube. When they are ready to put in the breathing tube, it's usually her, show me her vocal cords on a camera, like on a TV that I can see. I mark where they are by putting a pin in the larynx or in the voice box above where the vocal cords insert. And that is how I know it's safe to take all this cartilage up above here without disrupting your vocal cords. Then next thing we're probably going to do is the chin. So what we're going to do is narrow the chin a little bit, but also bring it forward. So that is going to create more of a like heart-shaped face. Even though I'm bringing it forward, which is technically making it bigger, it actually is going to make the lower face look more narrow and more slender.
Oh, yes.
Which is going to be really key for feminizing, but also just for balancing your face. Most of the attention, I think, goes to your eyes from the side. Even though we did the nose, it still looks big because your chin is small.
Oh, yeah.
So so the things that stick out, the brow bone, the nose, and the chin, brow bone is perfect. We decided we're going to leave that alone. The nose looks like it sticks out too much, even though it doesn't, because the chin is just too far back. So pulling the chin forward is going to just bring the whole face into better harmony. So
Are you going to make it more like a V shape?
More V shape, yeah. So that's the thing. So what I want to do is burr it from the side so that it comes in more of a V, but then pull it forward. And that's really what's going to create the slant and the slope in your face. And then we're going to do something really cool that is brand new. She is getting Renuva, which is a synthetic fat matrix. She's thin, she doesn't have any fat, but we really want to do some fat grafting to the cheeks. So there's a very cool new product. It's only been on the market like a few months.
It was kind of hard to find reviews on it. Like,
yeah, because it's new. I think it's super exciting because we have this problem, not just with her, but patients who need more volume in their face, but they're thin, and they don't want to come back and get filler like every 6 months of the rest of their life. And fat is a really nice, soft, natural substance. So what this is like, it's a fat matrix basically that just kind of helps boost a little and grow some of your own fat. It's an injectable, and it's made just for this situation.
I know. How long does it last?
So whatever it takes will last forever. If they can mass produce this, like everybody's going to want it eventually because it's like a permanent filler. Not all of it is probably going to take, like somewhere between 50 to 80% of that fat actually stays and actually lasts. Yeah,
because I really like the filler, but it seems like it's...
You just metabolize it quick.
But it's like, where is it?
And that's the problem. I mean, I'm the same because I work out so much, so like I just burn off filler like nothing. Like I put it in and then 2 weeks later I'm like, where did it go? And then the last thing we're going to do is a little kind of mini lift, or I call it the mini lift with Renuvion. So little stab incision here, stab incisions behind the earlobe so no one will see them. We'll do a little lipo. She doesn't need much because she doesn't really have a lot of fat. Then the Renuvion is a helium plasma skin tightening device that goes under the skin, tightens the skin down. It contracts the dermal septal band, so it tightens the skin down. It's going to help show off her jawline.
Yeah,
really
looking forward to it. I'm like, no more of that Bob's Burgers.
Right.
It just disappears, you see?
Yeah.
Like,
so I think you were just born with like a small chin and a small jaw. We're going to fix it.
Alrighty, looking forward to it.
Yeah.
Don't forget to share, like, comment, subscribe.